Hello, hello. This is Dr. Eugene, your favorite psychiatric dual certified primary care nurse practitioner. I say welcome to all the psych mental health nurse practitioner students that will be having me for the semesters to come. So I like to give you this intro video to prepare you for clinical with me. First thing first, first thing first, always come prepared. What do you mean by come prepared? Show up on time. Clinical start at 8. You show up at 7:45. Set up your system so you will go smoothly. Second, dress appropriately. Do not wear sweats. Do not wear a hoodie. Don't look like you just woke up or you're sleeping in bed. You're supposed to be sitting in a chair. You're supposed to have your hair done, whatever, fixed, clean, appropriate attire. Noise. Try to dim as much noise as possible. So meaning, if you're going to be in a noisy area, move to a different area in the house that's less noisy. Okay? Always come prepared with a notebook and pen or with your laptop and your fingers. You're going to be typing or writing a lot. So important. There's two books I want you guys to have. And the two books I want you to have, please message me if you need copies of those. But the two books I want you to have is the Stall Prescriber Guide and the DSM-5. That's it. There's other good resources, but as a student, if you have too many resources, you get lost pretty quickly. So focus on those two first. You can always add on as you're practicing, but in order to pass, in order to understand the key concepts, and you can build on it, you focus on those two books. If you want to add on an app, the NEI app is based off of the Stall Prescriber Guide. Get the NEI app. They have a cool student discount of 90 something bucks. Use it. It will help you. Go sign up for that. Next thing is, so remember what I said, come prepared, show up on time, look the part, come prepared with your resources. Limit your questions to necessary questions. So what I mean necessary questions, right? Meaning, oh, I checked out Prozac. They were saying this. Why is it used for bulimia? That's a good question. Now, if you ask me, what is fluoxetine? Open your stall handbook. I want you to open your stall handbook and review what fluoxetine means or what Prozac means. I want you to know that generics are important in practice. They're important in practice and they're important for your certification. So generics is key. So when we go over meds, remember generics. You will thank me after. Your exams are going to be in generics. All your exams, from certifications for classroom exams, generics. Next thing is, when I say different slogans, different key things, write it down. It's meant for a reason. Not for a slogan, but it's meant because it will help you with treating the patient. Pay attention. Listen to the interactions. Listen to how I interact in follow-ups. Listen to how I interact in initial evaluations. When it's your turn to participate in a follow-up and an initial with me, you follow the way I do it, and when you're on your own, you do your way in order for you to successfully finish a follow-up or an initial. Because employers look at productivity and how many people you can see in a day and how many charts you can finish in a day, and so they can submit it to the insurance companies so they can make their money. If you spend weeks and weeks, months and months not finishing your notes, they're losing money, you get fired. So remember, time management is number one. You know that. Time management, number one. You have to change the mindset from the bedside now to being a provider in a chair. You have control of the medications you prescribe. You're responsible for the medications you prescribe. Your collaborator is why I say a collaborator, meaning, hey, just review, you'll review a chart once every few months, but you are the one to choose your medication. Remove the bedside. Remove, I should ask, what should I do with this? Remove that. What is the person presenting? What can be the differential diagnoses? Okay, this is what I think it is. Let's give this. Let's do this blood work. Let's do this. Let's send this out. You will make your decision. Get the nursing mindset out. You are a prescriber. So these are some few tips. Come prepared, come on time, come ready to learn. And believe me, you won't regret it.